Management of viral diarrhea. In winter, we have plenty of episodes of the viral diarrhea. They have loose watery stool, and commonest virus is being the rotavirus, followed by the enteric adenovirus, calcivirus, astro, and Aichi virus. These five viruses are responsible for the large majority of the loose watery stool. They do not have blood in the stool. They do not have usually systemic infection features. Adeno can have a little bit respiratory involvement. So the current day vaccine, has causes a little bit of blunted or changed position of the clinical scenario. They have orophycal transmission, and your rota is more common in the younger age group, and the others in a little bit in the grown-up child. So outbreak can be there, and the diarrhea lasts for 5 to 7 days usually, and you have the mild sort of dehydration, good amount of time. With a little amount, sometimes you have severe dehydration if it is not being attended. So diagnosis is clinical, and you have the features of dehydration because of salt and water loss. You can have little bit of disaccharidated loss from the gut. So there can be of the perianal excretion, reds and inflamed area around the anus. So it is possible. And if you look at the investigations, this stool RE is nothing revealing, normal. The viral non-structural protein 4 isolation is a sort of the academic interest or the lab clinical purpose. It is usually not done PCR, and treatment is management is dehydration. Amount of water loss is to be adjusted with the amount of water intake. ORS 10 to 20 TSF, 100 to 150, and double in case of about 2 years age group. And your feeding maybe 1 feet more. And when there is perianal excretion, lactose intolerance, the patient might be benefited by lactose-free soy-based formula. And some of the ectic diarrhea, that's it. Some of the if you have differential consideration, little bit of probiotics are used and recommended at times, but rota per se is not the practice, and you have case fatality is less. Vaccine available for the rotavirus, Rotaric, Rotatec, they are available in the market, given between the 2 to 8 months of age, and with good immunogenicity, 75 to 75% protection on an average, and 98% of the reduction of the hospitalization of severe attack, and your reduction of the hospital induction may be around about 2 years, a little bit less. So there is one more vaccine, live attenuated monovalent vaccine, 2 doses at 2 to 4 months of age, a little bit less immunogenic, and thereby hand washing, other preventive measures, vaccination, and they are the way out.